Hello everyone. I am Sridharan, Assistant Professor from this SNS College of Physiotherapy. In this video, we're going to see about the topic which is based on the cerebrovascular accidents. Cerebrovascular accident is nothing but the which is leads to the condition called the cerebral venous thrombosis. Here in the venous, which is known as the atrium and the ventricular system of the brain, which can leads to the thrombus formation. Thrombus formation is nothing but the blood clot within the dural venous sinuses and the cerebral veins, which leads to the traditional strokes involving the atrial blockage and the rupture. CVT, it is a cerebral venous thrombosis affects the venous drainage system of the brain. Demographical impact, it is nothing but the prevalence among the worldwide and as well as also the countrywide. Unlike most of these strokes are primarily affecting the old age persons, here mainly comes between the age group of 20 and 50 years old. There is notable predelimination of the women of the reproductive age and largely due to the unique risk factors associated with the demographic. Uh, so then the prognosis and the outcome, which is nothing but the despite advancements in the medical treatment, CVT can lead to the serious outcomes, the mortality rate, which is known as the death rate, and the severe dependence despite treatment over around 10 to 15 percentage. So this further significance of this condition is nothing but the patients may experience the chronic symptoms such as headaches, seizures, cognitive impairments, and even after successful resolution of the acute thrombotic event. Here, the CVT for the pathophysiology and the risk factors for the cerebrovascular accidents are first, we're going to see about the pathophysiology. In this, the thrombosis involves in the formation of clot within the brain venous system. This clot obstructs the normal venous outflow, leads to the cascade of the pathological events. Next, it leads to the impaired venous drainage. Impaired venous drainage, which is nothing but the blocked veins, which effectively affect the drain blood from the brain. Due to this, it finally leads to the increased intracranial pressure. The accumulation of the blood and cerebrospinal fluid leads to the increase in pressure inside the skull. Increase in this pressure inside the skull. This can causes the headaches and vomiting and the papilledema. This leads to the venous infraction. Venous infraction is which is nothing but the pressure it becomes too high. Increase in the pressure can leads to the venous congestion, and the parts of the brain tissue may have suffer from the reduced perfusion and leading to the infarct, which can be lead to the uh, uh, fatal condition, which is nothing but the hemorrhagic. Hemorrhagic is nothing but the rupture of the blood vessels. It is known as the hemorrhage. Risk factors for the CVTs are: first one is prothrombotic states, second one pregnancy and pneumonia. This period, particularly the postpartum phase, is the major risk factor due to the hypercoagulability and the hormonal changes, and it also leads to the altered dynamics. Then it can other risk factor is nothing but the infections and malignancy. Finally, the some other regional factors, which are the contraceptive use, dehydration, inflammatory bowel disease, backache disease, and the head trauma, which can contribute to the CVT risk factors. The clinical presentation and the diagnosis for the CVT are: the patients who have been affected by the condition, which have the 90% of patients have the headache, which ranges from the mild to severe and they mimic the other headache types. Seizures are more frequent, and they have an affected to the 20 to 40% of patients have shown to the clinical feature of seizures, and the insidious onset and the atypical pain have the patients have abrupt onset seen in the atrial strokes, while the thunderclap headaches, which have the severe headache reaching the peak intensity within the minutes, observed in less than 5% of in the CVT cases. Diagnostic modalities for the cerebrovascular accidents are first they have been prescribed to going move on with the MRI with MR venography. So this MRI we combined with the MR venography shows the reveal signs of the venous infection, hemorrhage or edema, while the MRV directly visualizes the venous sinuses and the cerebral veins, identify the filling and defects in the indicative of the thrombosis. Next, CT with the CT venography. So CT is nothing but the committee topography, which shows the direct signs of thrombosis, which have the dense triangle sign in the superior sagittal sinus, and the indirect signs like venous influx, hemorrhage, and finally these were the major diagnostic modalities used to diagnose the cerebrovascular accident patients. So thank you.